What if I told you that millions of men are living with prediabetes without even knowing it? The reason is simple. Prediabetes often develops slowly. In its early stages, it may cause few symptoms, or symptoms that are so subtle they're easy to dismiss as just getting older. Maybe you've been feeling more tired than usual. Maybe you're getting up more often during the night to use the bathroom. Or perhaps you've noticed you're thirstier than you used to be. These changes may seem unrelated, but sometimes they're your body's early warning signs. The encouraging news is that prediabetes can often be managed, and in some cases even reversed, with healthy lifestyle changes when it's identified early. Today, I'll share 10 early signs of prediabetes that men over 60 should never ignore, along with practical steps you can take to protect your long-term health. Stay until the end because the final sign is one many people never associate with blood sugar. Welcome to Men's Health Today. I'm Dr. Natalie Reid, and every week I share practical, evidence-based health information designed specifically for men over 50. Our goal is to help you stay active, independent and healthier for years to come through simple lifestyle habits backed by science. Before we begin, please remember that this video is for educational purposes only. It isn't intended to diagnose or treat diabetes. If you're experiencing concerning symptoms or believe you may have diabetes or prediabetes, schedule an appointment with your healthcare provider. A simple blood test can often provide important answers. Let me introduce you to someone I'll call James. James was 66 years old. He considered himself reasonably healthy. He wasn't overweight and he stayed fairly active. But over several months he noticed a few small changes. He felt unusually tired in the afternoons. He found himself drinking more water than usual, and he was waking up once or twice every night to urinate. He assumed these were simply normal signs of aging. During a routine physical, however, his doctor recommended checking his blood sugar. The results showed that James had prediabetes. The diagnosis surprised him, but it also gave him an opportunity. By improving his diet, becoming more active, losing a small amount of weight, and sleeping better, James was able to significantly improve his blood sugar over the following year. That's why recognizing early warning signs is so important. Let's begin with the first one. Increased thirst. Feeling thirsty after exercise or on a hot day is perfectly normal, but persistent thirst that seems unusual may be an early sign that your blood sugar is higher than it should be. When blood sugar rises, your kidneys work harder to remove excess glucose through urine. This causes your body to lose more water, leading to increased thirst. Many people simply assume they're not drinking enough water. But if you're constantly thirsty without an obvious reason, it's worth discussing with your healthcare provider. Persistent thirst doesn't automatically mean diabetes. Many other conditions can cause it, but it's a symptom that shouldn't be ignored. The second sign often appears at the same time, and many men blame it on their prostate even though blood sugar may actually be playing a role. Sign 2, frequent urination. As blood sugar rises, your kidneys to remove the extra glucose by producing more urine. That means more trips to the bathroom during both the day and the night. Of course, frequent urination has many possible causes. An enlarged prostate, urinary tract infections, certain medications, and drinking large amounts of fluids can all contribute. But if you've recently noticed a significant increase in urination, especially when combined with increased thirst, it's important to have your blood sugar checked. Sometimes the simplest blood test can reveal a problem long before serious complications develop. We've covered the first 2 warning signs. The next 2 are among the most commonly overlooked because many people simply blame them on getting older. Let's continue with the third warning sign. This is probably the symptom I hear about most often, and unfortunately, many people simply blame it on getting older. Sign 3, constant fatigue. Everyone feels tired from time to time, but persistent fatigue that doesn't improve with rest deserves attention. Your body's cells rely on glucose for energy. When blood sugar regulation isn't working properly, your cells may not use glucose as efficiently as they should. As a result, you may feel tired, sluggish, or mentally drained even after getting a full night's sleep. Many men tell me they simply don't have the energy they used to. While aging can influence energy levels, persistent fatigue is never something you should automatically dismiss. It can have many causes, including anemia, thyroid disorders, sleep apnea, heart disease, depression, medication side effects, and elevated blood sugar. That's why it's important to discuss ongoing fatigue with your healthcare provider rather than assuming it's just a normal part of aging. The next warning sign affects your eyes. And for many people, it appears long before diabetes is ever diagnosed. Sign 4. Blurred vision. Have you ever noticed that your vision seems blurry for no obvious reason? Blood sugar fluctuations can temporarily affect the shape of the lens inside your eye. When this happens, your vision may become blurry or fluctuate throughout the day. Some people think they simply need stronger glasses. But if blurred vision develops suddenly, comes and goes frequently, or is accompanied by other symptoms, it's important to have both your eyes and your blood sugar evaluated. Diabetes is also one of the leading causes of vision loss worldwide, which is why regular eye examinations become increasingly important as we age. Protecting your eyesight starts with protecting your overall health. The fifth sign often seems confusing. You're eating enough, yet you still feel hungry. Sign notch to 5. Increased hunger. Hunger after physical activity is completely normal, but some people with prediabetes notice they feel hungry more often than usual, even shortly after eating. This may happen because the body's ability to regulate blood sugar is beginning to change. Meals that are high in refined carbohydrates and added sugars can cause blood sugar to rise quickly and then fall again, leaving you feeling hungry sooner. Choosing meals that include lean protein, healthy fats, vegetables, and high-fiber carbohydrates can help you feel satisfied for longer. Eating balanced meals isn't just about weight management. It's also one of the foundations of healthy blood sugar control. If you've noticed persistent hunger along with increased thirst, frequent urination, or fatigue, it's worth discussing these symptoms with your healthcare provider. We've now covered the first 5 warning signs, but the next 5 are often even easier to overlook. One affects your skin, another slows your body's ability to heal, and the final sign may surprise almost everyone. Let's continue with the 6th warning sign. This one often appears on your skin, and many people don't realize it may be connected to blood sugar. Sign 6. Slow healing, cuts and wounds. Have you noticed that small cuts, scrapes, or bruises seem to take much longer to heal than they used to? Healthy healing depends on good circulation, a healthy immune system, and proper blood sugar regulation. When blood sugar remains elevated over time, your body's natural healing processes may become less efficient. This can increase the time it takes for even minor injuries to recover. While many factors can affect wound healing, including age, poor circulation, certain medications, and nutritional deficiencies, slow healing is a symptom that deserves attention. If you notice wounds that don't heal properly or become infected easily, don't ignore them. Speak with your healthcare provider to identify the underlying cause. The next warning sign may be something you've experienced but never thought twice about. It involves your hands and your feet. Sign 7. Tingling or numbness. Many people describe it as pins and needles. Others notice numbness or a burning sensation in their feet. These symptoms can have many different causes, but persistently elevated blood sugar may damage the small nerves over time. This condition is known as peripheral neuropathy. It usually develops gradually. At first, you may only notice occasional tingling. As time passes, the sensation may become more frequent. Of course, nerve symptoms can also result from vitamin B12 deficiency, spinal problems, poor circulation, medication side effects, and other medical conditions. That's why a proper medical evaluation is so important. Early diagnosis offers the best opportunity to prevent further nerve damage. The 8th sign doesn't usually cause pain. In fact, many people don't notice it until someone else points it out. Sign 8. Dark patches of skin. Some people with insulin resistance develop areas of skin that become darker and thicker than the surrounding skin. This condition is called acanthosis nigricans. It most commonly appears on the back of the neck, under the arms, around the groin, or in other skin folds. While there are several possible causes, it can sometimes be an early sign that your body is becoming less sensitive to insulin. It's important not to panic if you notice changes in your skin, but it's equally important not to ignore them. Your skin often provides valuable clues about what's happening inside your body. We've reached the final 2 warning signs. One affects your immune system, and the last is one that many men never connect with blood sugar until after they're diagnosed. Let's finish with the final 2 warning signs. These symptoms may seem unrelated to blood sugar at first, but they can provide important clues that your body needs attention. Sign 9. Frequent infections. Have you noticed that you seem to catch infections more often than you used to? Or perhaps minor infections take longer to clear? Persistently elevated blood sugar can affect how well your immune system functions. As a result, some people become more susceptible to infections, particularly skin infections, gum disease, and urinary tract infections. Of course, frequent infections can have many different causes. But if they occur repeatedly, especially alongside other symptoms we've discussed today, it's worth talking to your healthcare provider. Early evaluation can identify the underlying cause and help prevent more serious complications. Sign 10, erectile dysfunction. The final warning sign is one that many men are surprised to learn can be connected to blood sugar. Healthy erections depend on healthy blood vessels, healthy nerves, and proper blood flow. Elevated blood sugar over time can affect all three. In fact, erectile dysfunction is sometimes one of the earliest signs of diabetes or prediabetes in men. That doesn't mean every man with erectile dysfunction has diabetes. Far from it. Heart disease, high blood pressure, certain medications, hormone changes, stress, anxiety, poor sleep, smoking, and many other conditions can also contribute. But if you've noticed persistent changes in erectile function, especially when combined with increased thirst, frequent urination, fatigue, or slow-healing wounds, it's a good reason to schedule a medical evaluation. Sometimes treating the underlying health condition leads to meaningful improvements in overall well-being. What you can do today. The encouraging news is that prediabetes isn't a life sentence. For many people, healthy lifestyle changes can significantly improve blood sugar control. Start by choosing more vegetables, fruits, whole grains, legumes, lean proteins, and healthy fats. Reduce sugary drinks and highly processed foods whenever possible. Aim for at least 150 minutes of moderate physical activity each week. Strength training 2 or 3 times weekly can also help improve insulin sensitivity and preserve muscle mass as you age. Prioritize 7 to 9 hours of quality sleep each night. If you're carrying extra weight, even modest weight loss can have meaningful health benefits. And perhaps most importantly, keep up with your regular medical checkups. A simple blood test can often detect prediabetes long before complications develop. 6 months after James learned he had prediabetes, he returned for another checkup. He hadn't followed a crash diet, he hadn't purchased expensive supplements, instead he focused on simple habits. Daily walks, more vegetables, fewer sugary drinks, better sleep, smaller portions. Over time, those small changes added up. His blood sugar improved, he lost weight, his energy returned. And perhaps most importantly, he felt confident knowing he was taking control of his health before diabetes developed. That's the real value of recognizing early warning signs. They give you the opportunity to act while meaningful changes are still possible. Let's quickly review today's 10 early warning signs of prediabetes: increased thirst, frequent urination, persistent fatigue, blurred vision, increased hunger, slow healing cuts and wounds, tingling or numbness in the hands or feet, dark patches of skin, frequent infections. Erectile dysfunction. Remember, none of these symptoms alone confirms that you have prediabetes. Many other medical conditions can cause similar symptoms. But if you've noticed several of these changes, don't ignore them. A conversation with your healthcare provider and a simple blood test may provide valuable answers. If there's one message I'd like you to remember today, it's this: prediabetes often develops quietly. That's why awareness matters. The earlier it's identified, the greater the opportunity to improve your health through sustainable lifestyle changes. Healthy eating, regular physical activity, quality sleep, maintaining a healthy weight, and routine medical care remain the foundation of preventing type 2 diabetes and supporting healthy aging. Small decisions made consistently today can make a remarkable difference in the years ahead. Thank you for watching Men's Health Today. I hope today's video has helped you better understand the early signs of prediabetes and why paying attention to your body is so important. If you found this information helpful, please subscribe for more evidence-based videos created specifically for men over 50. Every week we cover diabetes prevention, heart health, prostate health, testosterone, nutrition, circulation, and healthy aging. I'd love to hear from you. Which of today's warning signs surprised you the most? Share your thoughts in the comments below. Until next time, take care of yourself, stay active, stay informed, and I'll see you in the next video.